Hey all, welcome to today's session. Using AI to develop patient cases. My name is Rahul Noria. I'm excited to jump on into today's session. Before we can get to building out the prompt, we're going to have to identify two different things. One is, what is our goal? We'll have to identify what our student learning outcomes are. What are our student learning objectives? Both of these will provide direction for our prompt and be able to assign a task to the prompt. The second thing I'll have to identify is, do I have a specific direction? What do I mean by this? Well, do I have disease states picked out? Is it going to be a simple case, or is it going to be a complex case? Second thing I'll have to identify is, do I have a particular format for this? Am I using my institution's format? Am I going to be using some other format that I found? And do I have ways of narrowing our therapeutic options? All of this will help set up a parameter and provide restrictions when the AI provides a response. So the goal that I'm going to use for today's example, and whatever goal that you want to use and build out a patient case, you can use the same exact instructions and directions that I'm providing today to build that out. But again, for today, we'll be building a patient case for students to complete a documentation note. Additional things we'll have to identify. So remember, this is the goal. The next part will be thinking about what specific direction do we need to provide parameters. So how many disease states do I want to incorporate? Is it just going to be one disease state, or will it be multiple disease states? What type of format do I want to follow? As discussed earlier, do I need to follow the format of my institution? Do they have a standardized way? Or can I bring in outside ways of developing that patient case? So that means, does your hospital provide a format? Does your clinic provide a format? Or does anywhere else that you practice provide a format that you can bring into the classroom? The last thing is, how are we narrowing our therapeutic options? Some ideas to do this would be incorporating drug allergies, medications to help maybe move a direction from first-line treatment to second-line treatment or third-line treatment. Maybe providing some drug-drug interactions or drug-disease state interactions. And there are multiple other ways of also providing other therapeutic options or providing ways of narrowing our therapeutic options. Next up, we'll be going over a more specific example that we'll be incorporating into the AI platform that we'll use today, which will be ChatGPT. So the case that I will use is going to be using an adult patient with type 2 diabetes that came into an outpatient clinic for a routine checkup. Things that we want to emphasize in this case: patient has had uncontrolled blood sugar levels the past few weeks based on their log. Patient has been somewhat adherent to their medications. Vital signs are within normal range. The current medication is going to be metformin 500 milligrams PO/BID. In terms of a format, when we move to ChatGPT, which we'll do shortly, I'll show what type of format I will be using to develop this patient case. So let's jump on into ChatGPT. Hey all. Now that we're at ChatGPT, before we begin dissecting the prompt, I just want to say a caveat. First off, I'm using the premium version of ChatGPT. Despite that, the way that we're building out the prompt, the way that AI is responding back to us, it should be pretty much the equivalent of what you're doing in the free version. So there should be no difference between what I'm doing in here, nor what you'd be getting in the free version. Yes, there are individual differences in terms of when AI responds back to you, but outside of that, the general gist should still be pretty much the equivalent. And this should also be applicable to other AI platforms, whether you're using Copilot, Gemini, Claude, Perplexity, all of those. The same way that we're building the prompt in here should be the equivalent of you doing that in any of the AI platforms. So let's now begin dissecting the prompt. So in terms of the prompt, you can see the first thing I did was assign a role. I always recommend this and recommend putting on a hat for the AI platform. That way it specifies for them what we're doing, it provides an additional direction, and oftentimes I find that the prompt response is going to be that much better. So in this case, I assigned the role of being a professor at a pharmacy school. The next part that I did is assign a task to it. So you can see I asked it to create a patient case for pharmacy students, and the patient case should revolve around the disease state type 2 diabetes. To provide additional direction, I copy and pasted the last slide that we had on that PowerPoint presentation into here. So now that we have all the information and a direction for the task, let's go ahead and talk about the format that I want ChatGPT to provide. Whenever you are providing a format, I recommend going ahead and utilizing the following sentence or statement. Once you have that statement, I recommend going ahead and having some sort of identifier of where my format begins and where it ends. You can see that I put quotes in here. So my quotes begin before the chief complaint and then after the lab value. This helps identify where the format ends and where it begins. Next up is that you can see that I went ahead and put in chief complaint, history of present illness, past medical history, family history, social history, medication lists, drug allergies, and then some additional amount of lab values. We're doing a simple case for this, and I didn't want to make it too complex with too much lab values. However, if you were planning on incorporating a comprehensive list of lab values, I would recommend breaking up your prompt into multiple prompts for the format. The reason why I say that is at times when you provide too much information at once to whatever AI platform you're using, it can get overwhelmed, and that's where it can start hallucinating or maybe not providing information that you're looking for. If that ends up being the case and you put in a lot of information, I'd recommend breaking it into smaller chunks at that point. So now that we set up our format for the case, there's one last thing I always recommend for people to incorporate, and that is this last question. That's going to be, what questions do you have for me before providing a response? What this allows the AI platform to do is to have a direct conversation with you, to ask clarifying questions, to make sure it understands your direction, your prompt. I find that this to be extremely helpful in getting a better response from the AI platform. Now that we've built out our prompt, let's see how it responded back. So what you'll see when you have that last question that's still highlighted in there is that you'll see it asks you questions and it'll have a conversation with you. So I'll respond back to those and provide a direction. When I'm responding back, you'll be able to see in here, all I did was add in a number and then provide a response. Don't forget, it is a chatbot. What that means is that it should remember context and content from whatever we talked about previously. So all I can do is just go ahead and provide a number to provide clarity in terms of which question I'm answering and then provide my response. We'll see how it responds back to this and what type of prompting it provides. So in terms of building out the case, we'll see that it provided a chief complaint, provided an accurate history of present illness with some really great points. It provided past medical history, family history, social history. It even came up with additional thought processes for the social history. Patient has a diet that frequently includes fast food meals to work schedule, is a non-smoker, doesn't use any alcohol, recreational drug use. It got the gist that I wanted this to be a simple case, not adding in too much complex information. It added in that the patient wanted to take a multivitamin or is taking a multivitamin. You'll see it added lab values, A1C, as well as a very nice glucose log. Don't forget, when we're building out this case and having it provide a response to the AI platform, don't forget that it is just a template. I always recommend to reevaluate whatever the AI platform is providing to you. If we're asking the students to evaluate patient cases or evaluating responses from AI platforms, we should be doing the same thing on our end. I hope this was helpful, and if you have any questions, please don't hesitate to reach out. Thank you.